Why is anatomy lab history important for med students? Anatomy lab history plays a vital role in the education of medical students. It provides a backdrop for understanding how anatomical education has transformed over time. This evolution has shaped both the knowledge and skills that future doctors will need. Anatomy labs have been a cornerstone of medical education for centuries. In ancient civilizations, early practices of studying the human body laid the groundwork for future learning. The Renaissance marked a significant turning point when figures like Andreas Vesalius made dissection a required part of medical training. This shift from simple models to detailed cadaver dissection has remained a key teaching method, even with modern alternatives available today. Understanding this historical context helps students appreciate why hands-on experience with real human bodies is still so important. It allows them to develop spatial awareness and psychomotor skills that cannot be fully achieved through textbooks or virtual simulations. The anatomy lab is where students learn to connect theory with practice, which is essential for their future clinical work. Additionally, the history of anatomy labs brings to light the ethical considerations surrounding the use of human donors. Learning about past practices encourages students to reflect on respect and professionalism. This awareness fosters empathy, preparing them for the human side of medicine, which is just as important as technical skills. From a practical standpoint, anatomy labs offer a unique environment for collaborative learning. Students work in small groups, allowing for interaction with faculty and peers. This setting contrasts sharply with large lecture halls, promoting active engagement and problem-solving. Such collaboration is crucial for mastering complex anatomical relationships that are vital for clinical applications. Moreover, the history of anatomy labs illustrates their role in merging foundational sciences with clinical skills. This integration reinforces the significance of anatomy in understanding disease processes, surgical techniques, and diagnostic procedures. It helps students see anatomy as an applied discipline, rather than just a subject to memorize. In summary, the history of anatomy labs is not just a collection of facts. It provides medical students with a framework for understanding the evolution of their education. It highlights the importance of hands-on experience, ethical considerations, collaborative learning, and the integration of science with clinical practice. This historical perspective is essential for shaping well-rounded, compassionate physicians ready to take on the challenges of patient care.